So I wanted to take you back to during the pandemic. What was it like being a surgeon in those years when we were in a shutdown, essentially?
That was hard. That was really hard. You have two competing voices in your conscience. On the one hand, you've been trained to look after folks, and you've dedicated decades to the process, and you believe that what we need to do here is do the surgeries, get these tumors out of these poor folks. Right, they're suffering. But on the other hand, we have this new beast out there that is also dangerous. And it just even interacting with humans is a risk. It was a terrible time. It was beyond frustrating, I think would be the best way to put it. Lying awake at night, it was bad. Because you want to look after these folks and you can't, and you're just thinking how hard it is for them. They're at home, and they have this thing in them that's growing, and it needs to come out. And every day is the clock is ticking. So yeah, it sucked.
In terms of patients, what was it like for patients? How were they affected by this?
They had it worse than the surgeons did because they were the ones who had to live it, knowing that there's something in there that needs to come out, and that time is, not all tumors are the same, but in general terms, time is of the essence, and just having to wait, not knowing when they're going to have a chance to have it removed, versus the risk of being in public and contracting or transmitting the virus, knowing that because they have a cancer diagnosis that they are, a little more vulnerable as far as their immune system is concerned. They had a hell of a go, and it was hard to watch, and it was hard to know that I am to be their advocate, and struggling to find a way to do that. Navigating the different risks that they faced. It was really hard.
It must have affected outcomes. I guess in two ways. People didn't get the surgeries they needed as quickly as possible. And perhaps you would know more, but were people were diagnosed later because of the pandemic?
Research is starting to emerge on a number of different fronts. This was sort of an obvious risk that the medical community, the surgical community knew. And research is starting to emerge that suggests that you are seeing patients who would ultimately get to the operating table with disease that was a little bit more advanced than it had been before. Now, that sucks, but we have to weigh that against the risk of what would happen if we had simply carried on as before. What happens with a completely unchecked COVID-19 virus? So we have this hindsight now, and you're starting to see these negative effects of the lockdowns, manifest themselves. But we have to remember at the time, you're looking at a situation, a completely novel virus, nothing like this before, in terms of the length of time of the incubation period, all of that. It was really hard to figure out what to do. We hadn't seen it before.
In 2022, you were one of the people who spoke about the fact that there was a backlog of 6,000 surgeries at two hospitals in St. John's alone.
Yes. Yeah, that was really hard. As the pandemic unfolded longer and longer, that backlog, gets harder to ignore. And then you start getting to the point where you're wondering if the competing risks are tipping over. How do we know the answer to these questions really? I don't know that it's knowable in a real, true mathematical, scientific sense. But I guess my own conscience started saying, I'm worried here. Now again, that's just one voice, right? We have to look at the public health voice. We have to look at, there's many people who, have skin in the game. It was hard. At that point, I felt I had to speak up.
I want to speak to you today because I want to talk about where we are now. We had that backlog. How are things going? Are we addressing that backlog?
We are. There's no question that the administration, that the political players are trying to move the chess pieces on the table to get the surgeries done. And I can tell you from the NLMA's perspective, in looking at the numbers, which we watch, you can see that things like cancer cases, some of the more pressing stuff, the cardiac stuff, the wait times are starting to come down. So the efforts are bearing fruit. But we're not all the way there. there are still a whole bunch of people in this province who have a surgical problem that is not cancer or something otherwise urgent, but is nonetheless really affecting them. I've said it before, but there's a lot of guys in their 30s, 40s, gals too, with mortgages to pay, mouths to feed, that because of what's wrong with them, they can't work, or they can't, and this affects their family. This affects their mental health, their participation in the community. So those issues, I think, and I'm speaking in broad terms here, but it's from what the NLMA can see, those issues are the next that need to be addressed. I think it's fair to say we've turned a corner, and it feels good. Yes, let's get back to normal. Let's look after these folks who've been suffering and waiting longer than they should have been.
The things that have caused the backlog that we talked about a little bit are the pandemic, and there was that blizzard in 2020, and then, of course, the cyber attack. But the other issue, I think, is the demographics.
Yes.
And how is that affecting surgery and backlogs?
When the oil money was flowing in this province about 15, 20 years ago, probably it was time to start investing in infrastructure, in personnel, technology, you name it, in anticipation of the baby boomers, arriving at their healthcare years. And I'm not blaming any particular administration or political stripe at all, but that process didn't start to unfold. It never really did. And then all of a sudden COVID comes along, and now you have basically two tidal waves now forming one large tsunami of patients who are now waiting longer than they should be. And so it's hard to solve it because you have to unwind things that didn't happen in the past in terms of how many trained personnel, doctors, nurses, techs. These people don't appear overnight. They need years of training to become good at what they do. We can't magically create 5 more ORs because it's those rooms are so sophisticated that it takes years really to build them. And then, of course, this province is chronically, financially strapped. So these are really complicated problems to solve. But there's no question that the demographics added just another element here, making it even harder.
I think for a lot of people who are seeing issues like, radiation therapists, meaning a shortage of radiation therapists, meaning people have to leave the province for treatments and stuff, they're seeing these little crises in all these areas that sort of amount to a big crisis.
Well, there's no question that healthcare is such a complicated thing to do that you're going to run into problems and you're going to need to put fires out. And I know that it can feel like we have all of these different things going on at once, but even still, I can see that we're getting through it. I can see that we are in a better place than we were, a couple of years ago. There's no question in my mind.
And this past June, the government endorsed the Surgical Task Force recommendations. I think there were 32 recommendations, and the government said that it expects within 6 months to have them all adopted. That would put them at February of 2024. Do you think that's doable by February 2024?
I don't know that all of it is doable. I just think, as discussed, these are complicated things, that there's a lot of players and factors. But I know that the government is in constant communication with the NLMA about this, and that we're sort of seeing things find their way. Progress is being made. Is it perhaps too optimistic to suggest that February 2024 everything is going to be resolved? Probably. I think in a real world, as long as we are making progress, as long as we continue to see wait times come down, we just have to keep faith and keep going.